I would like to welcome everyone to How Foundation's second annual Brain Health Week speaker series. And today we are very honored and pleased to have with us Dr. John Conde.
Thank you.
Thank you. Of the Conde Center for Chiropractic Neurology here in Delray Beach. And Dr. Conde is a board-certified chiropractic neurologist. He is one of only 1,000 doctors in our entire country that completed this 3-year specialty in neurology and has that designation. He has had postgraduate training in traumatic and mild traumatic brain injuries and also in vestibular disorders, among other things. So, Dr. Conde.
Thank you for having me.
Oh,
this
it's
is
a
an
pleasure.
honor.
Thank you. Can you tell us briefly, please, about what you do, how you're involved with brain health, your practice?
I am a board-certified chiropractic neurologist and a diplomate of the American Chiropractic Neurology Board. What that whole thing means is that we treat neurology, anything neurologically based, any neurological disorders, especially pertaining to the brain. Mm-hmm. So we're looking at things like concussions, which are these traumatic and mild traumatic brain injuries, amongst a slew of other neurological conditions. But the concussions and the brain injuries are really a hot topic nowadays, mm-hmm. And there's a lot more research going on. So that's really where we focused our practice on is these traumatic and mild traumatic brain injuries.
Right. So you pick the brain as opposed to backs or
right.
hips or knees
that's
or
right.
something like that.
Well, that's what that specialty track
mm-hmm.
that I accomplished. That's kind of what we
mm-hmm.
focus on is the brain. And really, what I really want to emphasize, and what this Brain Health Week is so wonderful, and it's highlighting is really the way that the brain can change and mold and really adapt. Now, those are the concepts of neuroplasticity.
Neuroplasticity.
That's right. That scientific principle that we now know with this new explosion in neuroscience in the last 21st century.
Right.
It's really brought that to fruition. We know so much more about how the brain can change and make it change.
Right. And that's neuroplasticity, right?
That's
it's how the brain can change and develop.
That's right.
It's pliable.
Pliable. It's plastic is
mm-hmm.
really the term. It's a Greek term,
mm-hmm.
but it's really a neat thing because we can apply it to these brain injuries amongst other mm-hmm. neurological conditions and really get people better and faster.
Right. 10 years ago, they didn't know that, right?
No.
If someone got a concussion, it was rest and do nothing. And now it's more, I know you have all these equipment, you have different equipment for brain exercises.
That's
Can
right.
you speak to that
Yeah,
a little
sure.
bit?
So, typically, even when I first started practicing, 14 years ago, initially it was brain rest. You
mm-hmm.
you had a brain injury, you rest.
Right.
No lights, no sound. And typically that's okay for the first couple of days,
mm-hmm.
but then you really have to start getting the brain active again so
mm-hmm.
that the brain doesn't kind of really get into a dysfunctional state and really
mm-hmm.
can stay like that. We want to
right.
start to activate these brain areas so that they start to express their ability to heal and
mm-hmm.
really just accelerate the healing process so that they get, again, better, faster.
Can they build new pathways? Can the brain build
Absolutely.
new pathways?
That's the neat part of it.
Mm-hmm.
The brain can build new pathways, and it can actually increase the number of pathways, and actually increase the amount or the degree of communication,
mm-hmm.
which is in a neuroscientific world is an amazing feat.
Mm-hmm.
And I think it's not going to be too long before we can use this data and this information to treat spinal cord injuries. It's that really
fabulous.
Amazing.
Yeah, that would
mm-hmm.
be great. Yeah. Now, what kinds of people do you work with? Do you work with athletes and veterans and football players?
Yeah.
Riders?
So we've worked with football players,
mm-hmm.
college pros. We've worked with boxers and UFC, the new fighting fighters that are out there.
They get
but we've really and even something we've been focusing on more is the equestrian community.
Mm-hmm.
Okay, it's a big deal down here in South Florida.
Right, it's equestrian season now.
It's
Wellington.
A
mm-hmm.
big deal. So
right.
And people don't realize what a sport it is and what it really requires a lot of athleticism and really clear mindset.
Right.
and they get injured, brain injured as well.
Have you treated any brain injuries
We have.
for riders? Can you speak about that a little bit?
Yeah, sure. Primarily we've treated dressage riders and jumpers. Okay.
Interesting.
Yeah,
The
and
jumpers you'd think would have brain injuries because they're going over those fences.
right.
But even dressage riders who are just sitting on the horse can get bad brain injuries.
And it's a great, point that what you're saying with those types of that being prone to the head injuries. I will tell you that what people don't realize is that the dressage riders have to really maintain a nice posture. They have to maintain a steady force on the horse. And we see, besides having brain injuries, they have a lot of neck injuries because of this rigidity they have to have sometimes on the horse.
Interesting.
So whereas the jumpers will have more of a severe brain injury typically when they come in for injuries, just because of the degree of what they're doing.
Right, the speed and everything.
Yeah.
Do you have a case you could tell us about, a jumper who was injured?
Yeah, sure.
That you were able
Absolutely.
to have,
we've treated several. Now, one that just really comes to mind, a dressage rider. Just like any athlete, they want to get better fast, get back on the horse, and get back out there to do what they want to do.
Is there a lot of denial about having a concussion
there is
and an injury?
a lot of denial, and in fact, some PTSD, right? Some post-traumatic stress from the actual incident. So they're afraid to get back on the horse, and they're afraid to. At the same time, they want to get back out there, but they're hesitant. They're hesitating because of some of the fear. But the dressage riders we treated, typically they want to get back out there fast. They're upset that they're not. They have to have really nice form when they're working.
Yes.
So you can imagine if you've had any kind of a head injury and you're not focusing clearly, your posture's not great, you're not going to be able to do
It must be so frustrating.
the level of what they at where they want to compete is they're not able to attain that. So they get very frustrated.
Yeah.
So thank God we've been able to get them out there and get them back and having confidence and having that great posture, and the jumpers as well. The jumpers typically, I find them to be a little bit more gung-ho, ready to get out there quickly, and not so much of the PTSD with them. But I will tell you that typically after a brain injury that I've treated in terms of the equestrian community, it takes about a month, to really make some change and be able to stabilize the brain. It doesn't mean that we're going to keep them off the horse for a month, because a lot of them won't do that.
That's not bad at all, though.
Yeah. But we try to really, and of course, it all depends on the severity of the injury, the location in the brain, the compliance of the patient, and then how long they've had the injury, right?
Right. Do most people come to you like the dressage rider? Did they come to you right after they fell off the horse, or did they wait for a period of time?
Most of them will wait a little bit, so they may do some conventional, brain rest type therapy, maybe take some medication, do some things. Trying some things to maybe get themselves back on.
Right.
But typically we'll get them 3 or 4 weeks after.
3 or 4 weeks.
Yep.
So it's still pretty close to the concussion. It's not like they've waited years.
Right.
Okay.
No.
So 3 or 4 weeks after, and then what do you do with them?
Well, we really give them I think that the fundamental aspects of a good treatment plan is the actual examination. So we put them through a slew of different tests, everything from looking at their eye movements with this really high-tech equipment that we have, something called visual oculography, to a balance assessment. We use these really fine-tuning equipment to really assess their balance. We check their processing speeds using some equipment to test how fast they're able to react to lights and things like that, and timing mechanisms. It's really then once we get that diagnostic, together, the baseline, then we're able to construct a treatment plan aimed at their deficiencies and their sport. And the equestrian community, we're trying to get them back on a horse. So we'll kind of create the treatment plan according to their deficiency. So the rehab may incorporate timing mechanisms and getting on and off a horse, or for dressage riders, having to maintain stability while there's turbulence amongst, so we'll actually recreate some of that environment while we're having them do these cognitive type exercises and eye tracking type exercises, very kind of specialized.
So interesting. So it's not like just do nothing until your headaches go away or until you can sleep through the night, but actually there's a lot you can do.
Yeah,
and you help
absolutely.
them with that. That's really interesting. You've also worked with football players.
Yeah.
What can you speak about
Yeah,
that a
sure.
little
In
bit?
fact, one of the most things I'm proud of is that we were part of a study with the Upledger Institute, as well as the Ricky Williams Foundation. So we actually did a research study with 6 retired National Football League players, using some of the equipment that we have, and just looking at, how are they presenting? Are we seeing a lot of really old injuries? Are they lacking in processing times? Are they really just unable to see clearly or track clearly? How's it affecting their life? It was really, to me, it was a wonderful study. We're able to get a lot of information, and then just kind of assess the players and see where they're at. I love football myself, and it was a real treat for me to see some of these athletes come in.
I'm sure. And so were most of these chronic concussions? Because I know we've worked with football players at Hal Foundation, St. Mark, super duper. Back in his concussions were from the mid-'80s. So were
Right.
some of these football players
Chronic,
chronic?
they're all chronic.
Yeah.
Yep. So years of head injuries. Some of them have had multiple brain surgeries. But the wonderful thing is that is a lot of them have used hyperbaric oxygen therapy, which is really one of the fundamental constructs with the Hal Foundation, right? So
Yes.
and hyperbarics is a fantastic treatment.
Yeah, can you speak? I'm thinking about this patient that we worked on together, worked with together. Let's call her patient B. And she was an athlete, and then a D1 athlete, and then she had 2 concussions from something unrelated in a week. And then I remember she said that she had migraine headaches every single day for 3.5 years after her second concussion, and she was not able to work. She had to move back home with her parents, and then somehow at a later date she got a position down here in Florida, and she was treated by you, and she was getting better. And then you referred her to hyperbarics, and we were able to help her. We were going to give her 40 sessions.
Yeah.
And I know that after 20 sessions, she said all her headaches were gone. She was off the medication. So she didn't want to take the funds away from someone else, a veteran or some other person that was injured and needed them. So,
she was a miracle story. Just an amazing young gal that really needed help. She, just like you said, a D1 athlete,
so
just
hardworking.
just hard worker,
Yep,
and
good kid.
Suffered a couple of brain injuries in a pretty close proximity. And typically when that happens, it really increases the severity of it, especially, she came to us after a while after they had happened. But yeah, we assessed her, did a lot of treatment, and really responded well. But, we got her to about 70%, which was wonderful. I mean, she was really doing better, but I knew that there was something missing, and hyperbarics was really the answer to get her to over the top.
Level. Yeah.
So what an experience she had. And I think really to this day, I still see her every so often. To this day, she tells me how amazing she's doing. She'll have a little headache here and there like most of us. But she's advanced in her job. She's just really doing well personally.
Yeah.
It's really gratifying to see that. It was just a wonderful experience to work with her.
Yes, it's so exciting. And she said something to me too that I thought was very interesting, and maybe this is the neuroplasticity, that even months after she'd had her last hyperbaric treatment, that she noticed improvements. And is that something that you hear about with your practice too, that people will, say one of those riders, the dressage rider or the jumper, will you see them 6 months or a year later, and will they say, I'm still getting better, my brain is still
It's
improving?
still adapting, absolutely. In fact, I have a couple of patients around that I can just think of that are still telling me that, it takes time for the brain to really fully heal, So it takes about a month for there to be protein turnover. That means that the body's trying to replenish and heal, but it takes several months and even years to really gain true change. So yes, you're right. We do. I see that all the time.
Interesting. And do different people react differently? I mean, do some people get really exhausted after you're treating them, and some people have more energy right away?
Everybody's different. Yes, some people have fatigue. Some people will just really jump out of the office and just be doing great. For the most part, it takes a little bit, I'd say maybe a week, couple of weeks to really start to change and to see improvements and to be, think more clearly and have less fogginess and all the symptoms of concussions and brain injuries.
Yeah. And what about, do you work with young athletes, or how do you deal with denial? Like, oh, I'm fine, I don't have a problem. I just want to get out and play, or,
Yeah.
Say a veteran that's, done a number of tours. I'm fine.
Yep. So
go
it's
back.
funny you said, because even pertaining to veterans or even an athlete, they want to, they think that they're fine and they want to get back out there. But part of having a concussion and a brain injury is that you will get more irritable. You will get sometimes even slightly depressed, or you may get anxious.
Yeah.
And that really, those mental health issues play a part in their ability to get better and to receive the treatment they need after the head trauma.
Yeah.
So
Yeah, the invisible wound, right?
Yeah.
Our patient that I'm thinking about, patient B, she said that when she moved back home, she looked fine. So even her parents would think that she was fine. And she had to wrap a Band-Aid around her head
Right.
to remind her parents that they couldn't, yell for her in a loud voice,
Right.
because that would upset her.
Right.
Or, come up behind her and tap her on the shoulder.
Right.
And
Startle type things. Yeah.
Yeah. And I mean, I guess there are a number of people, I mean, veterans with post-traumatic stress and head injuries that are walking around like
Just
that.
like that.
Yeah. And, we don't even know.
Right.
We want them.
They don't even know.
They don't know.
And that's the part where I think what you guys are doing here, the How Foundation, with creating awareness is fantastic, because they may not know, they're walking around, they don't feel well,
Right.
but they don't understand that maybe there's some help out there.
Exactly. Yeah, they've done so much. They deserve everything
Right.
that we
Absolutely.
can give them. Every way we can
100%.
help them. They've already done everything for us.
Veterans need to come
Yeah.
first with that. Yeah.
Yeah, exactly. And I know you've worked with some veterans too in your practice.
We have, and I really enjoyed doing that. I really just to give back to a person that's given so much for their country, is really neat. So.
And it's so gratifying. I know the veterans that we've worked with, to see what they do when they're healed.
Right.
And they take all that great training that they've had and the experience, and that they do really interesting, wonderful, productive things.
I'm sure. I mean, it's personally and professionally for them. It's really opens so many new doors. So,
yeah, it's very exciting, because that's why we do.
That's right.
Do what we do.
That's exactly right.
Yeah.
Yeah.
So what does it mean to you to support brain health?
Well,
how can other people
I mean, I think supporting brain health comes through in many different ways, right? So it can be doing what I'm doing right now in terms of trying to create some awareness. It can be what How does every day, right? It can be research that we've done in the office that I'd like to do another study here in the future. I think research and creating more awareness and more information on how to get veterans and athletes and people with that are concussed and have brain injuries to get them better. I think to me, it's a passion. I truly enjoy understanding how the brain works, and continue to edify myself on and our practice on, how to improve brain function after an injury. So research, really pushing the active healing process is important. I think that's something that I've really tried to push in my office and throughout. I know our professional career, in terms of chiropractic neurology, all of my colleagues are trying to do the same thing. So.
Yeah, so if somebody, say, falls off a horse, or, has a concussion on the playing field, or has an incident like that, and they're told just to rest, take some time off, how soon after an incident happens are you able to help someone?
That's a great question. So, neuroplasticity, and just not to harp on that, but it's such an amazing principle now in medicine. the brain can change and adapt in a good way, but also in a bad way. So that means if you don't do anything and there's brain injury, a lot of times the brain will maladapt. So things will happen and it'll create kind of a negative functionality in the brain that sometimes is really hard to get rid of.
Oh, interesting.
So typically the cardinal rule with that for a brain injury, 3 to 5 days, you want to have some rest, okay? But right after that, it's right into doing some active, I would say 3 days. Then it's getting into some active rehab, doing things to slowly stimulate the system in the proper manner, address the dysfunctional areas that are, and try to kind of create some stability in the brain.
Interesting.
Yeah. Yeah, and then not soon after that, hyperbarics is amazing. I think that's such a compliment.
Yeah, it accelerates everything
oh my goodness.
that one is doing.
100%.
Yeah,
I mean, it is.
to heal.
If we could have one in every medical office, I think it'd be
Be great, right?
fantastic.
And every training center,
Every
near
training
every training center.
Right, every
writing center.
Military base,
Yeah,
right? I mean,
exactly. Someday.
Yeah.
Yeah. Oh, that's very interesting. And that tells us too why if someone had concussions years ago, like some of the football players that we were talking about, because their brains have obviously maladapted, right?
they've maladapted.
And because they didn't know to do something about it right away.
So true.
Yeah.
Right.
And that's why it takes so much more treatment. I mean, more. The protocol for hyperbarics was 40 sessions.
Right.
And now we're seeing people that can be healed in a lot less time. And especially if the injury is more acute.
It's fresh.
The concussion is fresh. Yeah.
That's
And you see that in your
oh
practice
goodness.
too.
Yep. The fresher the concussion, the easier it is for us to get them out there.
Right.
But not to say, look, even the chronic patients, we really enjoy working on them too, because
Sure.
even making any kind of a change in their life is huge for their ability to function, and really just live their life.
Right.
So,
Yes. It's exciting to see where people that have had those brain injuries for so long and, been suffering with the headaches, the lack of sleep, the irritable behavior, the mood swings, how they can normalize and be happy, normal people.
Right.
Afterwards. That's very exciting. It's just too bad that they've had to go through all those issues for so many years.
It's
unnecessary,
right. It's unnecessary. But I think, again, with all the medical information we have out there, all the research, the data that's out there, we know better now.
Yeah.
We know better, and trying to really educate even the primary care providers, the doctors maybe that aren't so really informed.
Right.
Getting them informed is huge, because a lot of times patients will go to their primary doctors first without and the primary doctors, if they're not really astute about what's out there now, it can really have an effect on that person's life. So
yeah, well, this is great, and to be able to disseminate all this information like this, and we really appreciate you taking the time.
It's my pleasure. This is wonderful.
Thank you so much, sharing everything, with us and our audience. If anyone out there listening would like to contact you and benefit from what you do, if they're having some kinds of issues with concussions or just want further information, how can they get a hold of you?
Thank you so much. I appreciate that. Yes, that's really our mission and our drive is to really help these patients with neurological deficits. So our office information, basically the easiest way to get a hold of us is to call us. Okay, so our number is 561 area code 330-6096. And then our website is thecondecenter.com. Okay,
great. Let's say your phone number again,
if
that's the easiest way.
Thank you. It's 561-330-6096. And then thecondecenter.com for the younger folks out there that get online, and you can check out everything we do. You can check out testimonials and just kind of get an idea of what kind of tools we have and equipment and what our niche is and that type of thing. So
excellent. Well, thank you so much, and I hope a lot of people can benefit from that.
Thank you very much. I appreciate it.